Hi, good morning. So today I will be talking about Tyson's case summary and also his plan for assessment. So Tyson is currently 13 years old. He is Aboriginal and recently he has been referred to the speech pathology as a part of his bail conditions. For the medical and developmental history, we have limited information about him. He was assessed at the Child at Risk Health Unit in 2012, and he was reported as having limited babble but normal walking. For the social and education history, him and his older brother, named Travis, were placed in out-of-home care unit when Tyson was 1 year and 6 months old, following the exposure of family violence and unstable mental health. He and Travis, his older brother, remained with the same foster carer until Tyson was 12 years old. And after that, they were placed in separate residential care because of property damage and physical and verbal aggressions that they're involved in. For the education, Tyson started kindergarten in 2016, but repeated again in 2017 because he made minimal progression with his reading skills. It was recommended that Tyson receive assessment for his literacy following his attendance to the reading support class, where they teach Tyson to use compensatory strategies for reading. So Tyson feels embarrassed with reading out loud and he has difficulty in interpreting or understanding different text types and also on making inferences. And right now he has reduced school attendance as well. So for the speech pathology history, he attended the speech pathology at Therapy ACT in 2014 from his delay language development. His latest language assessment using Cell 5 in 2022 revealed that his overall language skills were poor with stronger expressive language. So the plan for assessment with him, I will look at his two areas, including language and literacy. For the language, I will look at his receptive and expressive language. For receptive language, I would use a Peabody Picture Vocabulary Test or PPVT-5 with him to look at his receptive semantics in single word level. And I will also use the informal assessment to look at his receptive language in phrase and sentence level by asking him to follow sequential directions like close your eyes and touch your nose. And for the expressive language, I will use a test of adolescent and adult language or TOEFL with him. So TOEFL is the tool that we use with individuals aged 12 to 24 years old without any bias to ethnicity. So this tool assesses his higher level of expressive language, which includes word opposites, word derivations, analogies, word similarities, sentence combining, and also on orthographic usage in both written and verbal forms. For the contingency, I would also use the Rainfru action picture test for him to describe the action picture, and I will see his semantics, syntax, and also his morphology, but the norms from the Rainfru will not be used with him. And I will also use the informal assessment to look at his pragmatic skills from the conversation, like the eye contact, turn taking, and topic maintenance as well. For the literacy, I will look at his three areas, which include reading comprehension, phonological awareness, and writing. For reading comprehension, I will use a York assessment of reading for comprehension or YARC with him. So the questions from YARC can give us his level of reading comprehension in concrete facts, like the question of what, where, and who, and also on inferences, like the question of how and why. For his phonological awareness, we know that people with language disorders or DLD, they have impaired phonological awareness that will affect on the literacy skills like reading and writing. So I would use the comprehensive test of phonological processing, second edition or C top 2 with Tyson. And for the writing, I would ask Tyson to write about his favorite hobby, which include BMX bikes or swimming or rugby or boxing in 10 minutes. And I will observe his writing. And I will also ask for the writing sample from his school and from the TOEFL that we did earlier as well. So for the gaps in my knowledge right now, I will propose it into three questions to the clinical supervisor. The first question is, does Tyson use Aboriginal English? If so, what are the strategies that we can help with the assessment and intervention for the people who speak English as a second language. The second question is how do informal assessments work towards indigenous people? And the third question is we know that some indigenous community they value the way of learning through listening and watching alone. So if that's the case, what are the strategies that can help or educate their learning of language without interfering their cultural background?